Hello and good evening, everyone. We hope all of you are staying safe and staying at home. My name is Tharindi Thalahiti. I'm the Deputy Editor at Pulse, and I will be your moderator this evening. So let's get straight into the panel discussion. Sri Lanka faced the grim reality of COVID-19 from the first quarter of 2020. And a little over a year later, we're bracing ourselves for the impact of the third pandemic, which is currently sweeping across the country at an extremely fast pace. So, with an average of over 2,500 daily cases coming in and an average of over 30 deaths on a daily basis as well, the resources prevalent within the healthcare system are extremely strained and it's actually reaching a maximum capacity as well. So while it's important for us to stay home and stay safe and follow these health guidelines which have been put forward by health officials, it's also important for us to take a look and have a deeper understanding about the realities of being a COVID patient here in Sri Lanka. Because as this pandemic progresses onwards, the chances of us testing positive progresses onwards as well. And there is a sense of stigma as well as a sense of fear which comes with testing positive. And this sense of fear which comes in more often than not prevents us from actually coming forward and reporting ourselves or informing the relevant health authorities rather about our situation simply because we're afraid of being sent off to different quarantine centers across the country. So the purpose of this particular panel discussion is to really talk about the stigma which is behind quarantine centers in Sri Lanka and to talk about the needs and the necessities of healthcare workers and frontline workers as well as COVID-19 patients, and also to talk about the needs which are prevalent among these quarantine centers across the country and how we as a public can really support these quarantine centers in a very practical manner given the current situation as well. So our panelists this evening include Ms. Kumudini David, who is a social influencer and a passionate advocate for child rights and mental well-being. She recently was quarantined at the Rambuka Quarantine Center and is ardently speaking for the needs of this particular center. We also have with us Nadisha Mendes, who is a passionate individual in the human resources field. She has been actively involved in spreading a message of hope as a survivor of COVID-19 by sharing her story to the public and with people who are facing similar situations. Nadisha tested positive for COVID-19 during the second wave of the pandemic earlier this year in January 2021, and she was hospitalized at the IBH. We also have here with us Mr. Jude Pereira, who is the National Programs Manager of LEADS, a national non-profit organization operating in Sri Lanka for over 38 years. He's been involved in emergency humanitarian aid, community development, and child protection. So thank you so much to the panelists for being here and taking time off their busy schedules to be a part of this panel discussion. So let's get started. My first question goes out to Ms. Kumudini. So your experience and your time spent at the quarantine center was a real eye-opener for most of us. We saw you put aside your needs and come forward and really help people by not just providing material support, but also psychological support as well. So what encouraged you to do this?
Well, honestly, it was a case of I couldn't watch so many ladies and children in fear without doing something to elevate that feeling they were, and I felt it was something that I could help to do. I also felt that it was um, the fear was heightened out of proportion is the sense that I got after being with them for a while. It they seem to I think it kind of compounded all the circumstances and the fact that they couldn't. It's like being in prison, right? It's like being removed from society and isolated. The way that you're treated also from no one refuses to touch you or touch any of your possessions. You have to do all of it on your own, and when you're sick as well, and on top of having people keep a big distance from you, you feel really unwanted, right? And that is, I think, where the fear stems from and where the stigma also stems from. But having, even though I felt all of those, and it made me also angry and made me feel very lonely, I do feel I did feel at that point that the those circumstances were blown out of proportion, or rather the heightened sense of fear was blown out of proportion. That was my sense. And that's why I stepped in to try and diffuse the situation, because I didn't think keeping it like that was going to be healthy for anyone. So
Right. And Nadisha, what was your experience like as someone who tested positive for COVID-19 earlier this year?
Thanks, Arindi, for having me. So I think, from Kumu's experience and my experience, there are a few changes that were seen during the second wave compared to the third wave. And then we had the first wave. So sometimes I felt like the regulations were really tight at that point when I had it, because I remember when my father was first tested positive, we had to get the PCR test done and the whole process, and then I was tested, and then the regulations were very tight. We didn't, and I think Kumul mentioned in her stories that she had about 24 hours to get ready to go into a place, but whereas I think I had about a good 3 to 4 days to decide on where I had to go. But the story with me is that I'm an autoimmune patient. So I had a separate letter given by my doctor that I had to be in a hospital with a high intensive care unit. So it had to be a hospital with an ICU. And why is that? Because my condition is such that somebody like me, if I do get COVID, I can my systems can go into a drastic level from 0 to 100, where my breathing difficulties and all of that can go into another level. So they wanted to ensure of that. So that's the reason I was admitted to IDH. And of course, the stigma behind IDH and also the government hospitals, it was my first experience actually. And so I went into what they call the critical ward. And I had about 11 other patients with me, and most of them were elderly patients. I think majority, maybe 70% were the elderly. So they were maybe in their 70s, 80s. And unfortunately, during my 8-day stay at IDH, I had to witness 3 old ladies pass away in front of me. One was breathing for her life. Another one was, she came one day, and the very next day, we lost her. So seeing that was definitely very traumatizing. I didn't expect to see 3 people die in front of me. That's something that I never expected, but it happened. And when I remember when I was discharged, I asked the nurse, why is it that I had to see, in my ward itself? Then they said it's because you were put into a critical ward, because the ICU was right at the back. And at that time, my father was also hospitalized, and it was later that we found out that he had got COVID pneumonia. And so he was in the ICU for 4 days. So I couldn't see my father, even though we were in the same place. I was in my ward and he was in the ICU. And so, that was my experience with the second wave.
Right. And could you tell us the importance of why it's so important to have a deep understanding of your personal underlying health conditions? Why is it so important?
Yeah, I think it's very important, Arindi, because we tend to neglect the underlying conditions that we have within ourselves, because we don't go for checkups, and we don't really do that. I myself don't do it. But at the same time, me as autoimmune patients, I do have regular blood tests and checkups that happen. But for a normal average person, I think it's very important that you should know whether you have diabetes, or whether you have pressure conditions, or like Kumu was saying, how the sugar shot up and things like that. Like, I don't have any of that. So thank God I was all right. But it was not the case for my father. So, his sugar and pressure and all those levels rose, by the time he went to the ICU. So it's very important, because what happens is, this virus, when it hits you, it wakes up sleeping organs. And that means, you can't, it's unpredictable. You don't know what will happen at what point. So that's why it's important to know your underlying conditions.
To add to that, is saying I generally don't have a sugar condition at all. I am was diagnosed pre-diabetic, so I am on metformin, etc. That this is a while back. But while I was at the quarantine center, so they check sugar and your blood pressure every day in the morning. And even though I wasn't taking sugar, my blood sugar kept rising. It didn't spike out of control or out of normal range, because I mean the doctors and the nurses kept telling me that it was within normal, so don't worry. But then for me, watching my, noticing that my blood sugar was kept hiking up every day was very, very strange, because I wasn't doing anything that should hike it up, right? So what I understand from this disease is that every underlying ailment that you have will get heightened, and that is why this virus is so dangerous, because it can aggravate conditions that you already have. And from what I understand, a lot of the deaths are also due to aggravated other conditions, and not necessarily the virus itself.
Exactly. So it's important that people have a basic idea and a basic understanding about
uh,
their
uh,
health
you know
conditions.
sorry Tarindya, I
Yeah.
before I forget this particular incident, while the night that I was taken there was one lady who, she was unconscious, right? And she looked, it looked like she was having a fit. So we pushed her bed to the nurses the partition, and the nurse and the doctors were trying to get us to put the oxygen mask on her. We had to figure out how to, the whole oxygen mask apparatus, and how to fit the mask, and how to switch the thing on. And it was a it was a
Can
debacle
relate.
and a half.
I can
It
relate.
was, oh my lord. So all of that, and they we put the oximeter, the whatever pulse meter thingy, and it showed that her pulse and her oxygen levels were normal, right? But she was in a fit. She started, her eyes rolled back in her head, and she was shaking, and we were terrified. But thankfully, after a few minutes of the oxygen mask being put on her, she revived. And it's only the next day that we found out that she had gone into, her sugar had shot up. It had gone over 300, and that was why she was having a fit. Now, she didn't know that she was diabetic, and that's why, so she had to be put on insulin, right? But she didn't
Okay.
know that, so she could have died. And it
Wow.
was very scary. And that's also to bring that entire conversation to point, well, in a quarantine centers, especially in something like mine, where we are treated as asymptomatic, but quarantined for the benefit of the rest of society. Most of the time you have to do all of those by yourself. You have to fit someone within, one of the patients has to learn how to put all the equipment on the other patients,
It's
Okay.
the
because the
same.
nurses
Yeah.
and the doctors
Yeah.
don't come and do
They
that
don't,
for us.
so they don't necessarily interact with y'all as much, is it? Or
they
okay.
don't they don't come past the partition. It's a walled partition. It's a glass wall, and we interact through that. They don't come onto our side. They don't touch us. We
Okay.
don't get exact. So all of that is done by ourselves. The patients has to be talked through how to operate all of the equipment, and how to put it on other patients,
Okay.
and that
Right.
has to be done.
Okay. Right. So something else which we need to discuss, since we're talking about the doctors and the nurses as well, is the added stress that these frontline workers are also facing during a time like this. So how can we practically support them given the current situation as well?
So while I
About
was there,
stress.
okay, now it is very easy, right, when you're in that situation, to see the administration and the medical staff and all of them as the enemy. It's really easy, right? Because and if you don't decide, you don't change your mindset, it will stay like that throughout, that they are the evil people who are keeping us away from everything that is comfortable and normal, and they refuse to, they treat us as like treats us like lepers. You know, it's really really easy to fall into that trap and treat them like the big brother who is trying to keep us suppressed and uneducated and unaware, right? But that is actually not the case. If you take the time to talk to them, they're very human, and also realize that they are they are a limited resource, right? We don't have an unlimited resource of medical professionals or first responders. We have to look after them, or we have to step up to do their job. That's simple as that. So it is really really important that we look after them, because these people are working overtime. The
Exactly.
beds that we slept in at the quarantine center were the army's. The army had given them their beds, given us their beds, and they were sleeping on the floor. That is the message that we got. So those beds, the iron beds that we were sleeping on, were the armies. Their mattresses, their pillows, their beds. And these people were sleeping on the floor. They hadn't gone home. They haven't been given their vaccinations, even though they are in direct line of contact. They hadn't been given their vaccinations. And these people have the same problems that the patients have. And unlike the patients, where we cycle to that place every 10 days or whatever, uh, the the medical staff and the army especially don't go home for like months on end, right? So it's very important that we keep their mental health in mind, and also note that we can't afford to let them get sick. It's Nadi, what do you think?
Yeah, because I agree with that, because it's the same thing with the IDH setup. So as she said, we are separated by the cubicles, and you have the nurses and the doctors around you, and they will instruct you from there how to fix the oxygen mask and all of that. And at the same time, it was unfortunate to hear that, not even under a week, that the exact team that was attending on our ward, the ward had to close down because the nurses were all down with COVID. And so that's the risk that they're taking, and they come in, and then I also saw them, coming with their PPE kits, and especially for the archies there, the older ladies there, they had to come and dress them, put their pampers on and all of that. And they keep saying, we are doing this, it's a risk for us as well. And I was just feeling terrible, because I mean they are the real heroes out there, and also those PPE kits, like I think they have to, if I'm not mistaken, they have to change it every time they wear it. Like they can't wear the same PPE kit again. So you have to get another PPE kit, and then so it's another cost. So they're saying they're running out of PPE kits and all of that. So I mean, amazing. Like kudos to the doctors and the nurses and the team that even at with my own experience, which how they attended even at IDH, even with the lady who died, one of the ladies. She was rushed to the ICU just before she, because before she could even before they could even transfer her to the bed, she lost her life. But before that, I remember that we had to shout and say, okay, this Archie, like they become family, right? The patients around you, they don't become just your ward members; they become your own family. So we're like, I mean, Archie, husma ganna band, like they have to shout, and then the nurses come, and then we try to do what we can, and then finally they had to take away from there. But they have really gone out and done everything possible, and with all that stress and their everything that they're going through mentally, they're still able to be so nice to you, and to say how you're doing. They'll be like, Miss Nadisha, the like how, like they remember your names. And I mean, amazing team spirit, I must say. Yeah,
That's incredible. Jude, do you have anything to add to that?
Unfortunately, I was not a COVID-19 patient, Fortunately, unfortunately. And I mean, when I hear some of the stories, it's amazing. I mean, how others who are, not patients, others or service providers, how they sort of collaborate and support them, and it's a basic story.
Exactly, Jude. And also, there's a lot of public discussion going on right now, especially about how NGOs have contributed towards different relief efforts in order to support the government during COVID-19. And even Leeds has actually been actively involved in supporting the government as well as the different people from the very beginning itself. So, could you tell us how Leeds as an NGO sees the pandemic right now?
It's reasonable to describe this pandemic as a polycrisis, health crisis to begin with, but becoming quickly hygiene, humanitarian, and socio-economic crisis. Therefore, it has affected the most vulnerable communities of the society. And if you navigate the pandemic and its impacts, you can see it has drastic effects on the poorest of the poor segment. And among them are children, and they're the most vulnerable. Whether it is about health and nutrition, protection from all forms of violence like child abuse, education, and emotional aspect, it is children who get affected most. So, LEADS is a child-focused organization who works for well-being of children. Therefore, our objective during COVID-19 emergency relief is and was first promoting well-being of children, which includes protection. That means protection from all forms of violence and abuse. Second, ensuring good health of children, both physical and emotional. Third, economic support for the families to ensure economic resilience during and after the crisis. Therefore, we have implemented our emergency response from the first wave up to now to following interventions. To summarize a bit, providing psychosocial support for children in the child development centers in northern, poor, and western provinces, training probation officers and staff of those centers and children themselves. Second, providing hygiene packs and awareness session for the centers, establishing hand washing units in schools, ECCD centers, and child centers, and supporting dry rations, play equipment, and recreation items to those centers. And also providing personal protection equipment known as PPEs for government institutions and other institutions. Also providing dry rations and unconditional cash transfers to most vulnerable families in 8 districts. Also providing livelihood support for families to start their livelihoods, like that is for economic resilience. We also insist the importance of collaboration and partnership with government and other agencies at this point. And I think it should be a coordinated effort than working in silos. Therefore, LEADS was close with the various government entities such as National Child Protection Authority, NCPA, Ministry of Probation, Ministry of Education at national level as well as in the district and provincial levels. Our grassroots visibility, to tell you, is one of the strengths for us to work closely with government institutions. And I would say I'm very optimistic that this COVID menace can be overcome by well-coordinated effort of various sectors.
Right, thank you for that, Jude. And also, if I'm not mistaken, Leeds has also been supporting the quarantine center in Kandakadu as well, right? So could you tell us more about the work that you do?
Yeah, we have supported Kandakadu Quarantine Center and hope to support many other centers as well. The third wave of the pandemic has actually prompted us to relook the nature of our emergency response. That is to support dire needs of health services, in particular, as the numbers are getting double on daily basis. So Leeds will support hospitals and quarantine centers with needed equipment, PPEs, and so on and so forth. And we continue to support the vulnerable children and families both in the areas we work and also in the vulnerable district in Sri Lanka. I think I have to mention this, that when we made the appeal to support the people who are in the quarantine centers or hospitals, many came forward to support. You know, we have our traditional donor base, but for now, donor landscape is being changed. There are many local donors who show willingness and tend to support our emergency relief interventions. Actually, I personally think we humans are wired to show compassion and to empathize with the other person who is suffering. This pandemic has shown us a lesson to be compassionate and to look at the other person who is suffering is not different to you, but it is you who is suffering.
I definitely remember someone from Leeds reached out to me about Kandakadu. We were trying to get donations for Kandakadu, and donations are not coming in as readily as they would, needed it. I think mostly because even the 100 rupee, 500 rupee, 1000 rupee donation, those add up a lot. Most of my donations came in like that. Most of the donations were 1000 rupees or 2000 rupees or 5000 rupees, right? Like, there were one or two large donors who sent in 100,000, or there was one lady who sent in 200,000. But most of those are made up by everyday folks who set aside a amount that you would spend on a meal, right? And that adds up a lot. So it is, if you can donate, please do, because there are people who desperately need that help. That's something that I wanted to add regarding donations, when you are donating. And also there's how do I say it? When you're donating to a large organization, there is, I think, a mentality that you might be sending that money up the administrative stream, and it might not actually reach the people who need it. But I, for one, know that I apologize. I, for one, know that I've worked with Leeds for a very long time. I've known them for a very long time, and I know for a fact that, sorry, they care. Right? Nonsense, dog. So I turn all my donors, people who keep inquiring from me saying, how do we donate? How do we help? I send them all over to Leeds. I no longer collect donations because I don't have the logistical infrastructure to help all of these people. Leeds does. You want to help people, please help an organization that has the infrastructure, that has all the people and the systems and processes in place, and the connections. You need the connections, right? You need to be able to know who to send all of these things to, and Leeds does. That's why it is important that you send the donations to an organization that has all of those, right? Yes, they have administrative costs and overheads, but it is done to keep that process running, and a lot of people are living all of those. So please do donate.
And talking a bit about quarantine centers as well, Kumudini, so you've raised a lot of awareness and support about these quarantine centers. So what exactly is the need, and how can the public practically support these centers?
Well, you keep in mind that with the rate of the contagion, and the rate of how many people are getting infected daily, there is a high chance that quite a few of us are going to end up in these quarantine centers. It behooves us to make certain that these centers are habitable, right? And I'm not saying that they're not. They definitely are. It's just that once you're in there is when you realize that there are it's a very siloed environment. You are completely enclosed, and that community then becomes yours. You become part of that landscape, right? Now here that's one side of it. So when how do I put this, the biggest need there, what I felt, and the one that I addressed the most, was connectivity. Being able to reach out to people outside through your phones and etc. is absolutely important, because it that you feel as if you're not being cut off deliberately from society, right? Because otherwise that sense of isolation can be very, very daunting, and can be very heavy, can be very suppressive. So something to keep in mind that we don't realize is that most of these people who end up, and as Jude said, they are the most vulnerable ones who are affected the most. Like if you take a percentage wise, there will be more people who are daily wage earners and etc. in these quarantine centers than the the upper higher income brackets, right? Because most of the higher or upper income brackets will go for paid quarantine centers. It's only when you go in there that you realize that these people operate on a particular way. Just like it is a daily wage that they're earning, they pay for their connectivity on a daily basis. Most of these people don't qualify for post-paid connections, right? A post-paid connection is a uh, qualifier or a hallmark that you are of a more affluent class, right? I'm sorry, I'm saying it as it is. That is what it is. You don't qualify for a postpaid connection unless you can show that you are earning well enough to be able to be given credit, right? It's the same thing in banks, and it's the same financial model all over the place. You're taken as risk. It's the risk capacity. So these, most of the people who are vulnerable, who are in these centers, are high risk when it comes to the financial sense, because they are daily wage earners, sorry. The Because of that, those are the things that had not filtered out to society, right? To the people who can make a difference. Because I mean, look at it, the daily wage earners don't have a lot of voice in the social media concept, or they don't, they don't, a lot of them don't know how to make online transactions. A lot of them don't know how to connect their bank account to and download apps where they can do their reloads on their own. A lot of them don't have bank accounts. So the system, the financial systems and all of those are not really very well supporting. They don't support the daily age earners, right? So it's really important that we keep that in mind, that you have to be, you can't think in the holistic upper level only. You must go down to the grassroots and understand their particular needs to be able to address it. I mean, at the quarantine centers, they provide you with food. We got 3 meals, we got tea 3 times a day, we were given biscuits, and the food was plentiful and it was tasty. But with one of the hallmarks of this disease is that you completely lose your sense of taste and smell. So sometimes it actually feels like you're eating punnaku. It's horrible. It feels like you're eating hay, right? You don't know what got into your mouth. You know that it might be slightly sweet or slightly salty. Sometimes not that also. You don't know what you're eating. So the one of the biggest problems again in the quarantine centers was that the children weren't eating. I mean, to get the adults to eat was difficult, but getting the children who have, or who are sick and who have lost sense of taste and all of that, they just do not want to eat. So things now that I'm at home, I can tell you that the things that when I'm feeling the symptoms keep coming, because I think I've got long COVID. The thing that helps me the most are soups and soggy noodles and etc. Those are the things that I want to eat. I want to keep drinking things that are, soggy, warm. Those are the things that I want, and that is not what is provided at the quarantine centers. They can't do that. That's not the infrastructure that has been set up. And so you have mismatches there as well. Uh, so those are a lot of the things that I was a lot of the things that I was fixing was buying kottumi and soups and peyava and siddhalepa, and a lot of them were having headaches or hair oil. Those are the things that we were giving. Shampoo. We were they had run short of soap because you have to wash your own clothes plus keep yourself clean. So if you run short of soap, then you're done for. So no one's going to share your soap with you, right? So you have to get those. So I mean, it's those are things that happen in quarantine centers, and unless you go into those and you actually look at understanding the particular problems and keep your eyes open, you can't live in a bubble and just stay on your bed and be mournful that you've got sick. So anyway,
Right.
sorry,
Okay. Yeah.
there you
Right. Thank you for that, Kumudini. So let's talk a bit about life after COVID, or life after quarantine, rather. How has your experience been like immediately after leaving the quarantine center as well as leaving the hospital, Nadisha? And also, how have you been able to kind of maintain a positive mindset immediately after that, given the situation that you all were in?
I think just as Kumu said, when you go into these centers or hospitals, you can't sit in your bed and just wait. You will be you're put in a position where you just have to be involved. You have to get into that community, and you have to see that everybody's okay. But of course, there was a difference at IDH where the people were able to bring their stuff in, and most of the people were ordering from Uber Eats, Pick Me, and things like that, and they were getting food down because the appetite had gone and there is no taste. So people were getting a lot of stuff from outside. So that need was not really great there in the hospital. So when I realized that the quarantine centers needs were so much greater there, it really I had a different view about that. So that was new to me. And but yeah, after coming back, it was like a whole like a shift. You just shifted from one world, out of 8 days. You just come home and you're like, I think the first thing I did is I went to the shower and I just cried because I just loved being inside my shower after 8 days. And the feeling is,
Oh my Lord. I know the feeling. I loved my shower, being able to be in my toilet with a closed door. Because in the quarantine center, it was all out in the open. That was my first Dear Edda experience, literally. And but it was the one and only Dear Edda experience I've had, because from that day onwards, I decided that I'm just going to step into the water with the clothes that I'm wearing and wash the clothes and myself at the same time, because it it covered a whole heap of things at once. Uh, but yeah, wow.
That feeling is that's the feeling. Yeah. And of course, yeah, before I left, they did say, that I shouldn't go up and down the staircase, because I did have the shortness of breath a bit. It wasn't too bad. It was just, just mild. But I did realize in conversation when you're talking that, I had to breathe a bit. And I'm also a person who sings. So usually when I sing, I don't run out of breath so easily. But this time I couldn't sing for a good a few weeks. So the
yeah,
thing
it
is,
was.
yeah.
Sorry, I mean, that sense of breathlessness catches you completely off guard, because all of a sudden, like you realize that while you're talking, and then you're running out of air, and then you have to stop and go, and then start off again. So you end up panting while you're talking. It's
Right.
that was scary.
Yeah. So I think it's also
Bit of
very
getting used
important.
to.
Yeah. Yeah. So it's important that you rest. because as Kumu said, long COVID is a real thing. People do have these effects, and you feel all the symptoms that you felt pre-COVID. And I also had the shortness of breath for maybe another 2 weeks since I came home. So I took it really easy. I didn't go to do much around the house and stuff, and I had to take my steps slow, and everything you have to change your lifestyle, but you can't just go back to the roads or your offices and just go like everything is normal. So it's very important to rest. Very, very important.
I mean that's the inclination is to rush back into life,
Exactly.
right?
Yeah.
To get back to what you're comfortable with, your routines and etc. Because that is how we tell ourselves that life hasn't now become completely altered and it's a completely different reality. It's comfort, but it is very important that we realize that this is not something that you should take lightly. You have to give your body time to get out of it and recover. I have been in bed almost 90% of the time. From the time I came back home, I've been on bed. I've just been vegging out because the symptoms kept coming. I'm yesterday, day before, I had my 4th round of symptoms that hit me. But I have to say that it's cycling down. It's not as bad as it the first time. The second time was less, third time was less, and fourth time is
Right. So it's not
so I'm
something which
hoping that
just
I'm
goes. It's not something which just goes off within a
not
span
for
of 2 weeks.
me.
Okay.
Not for me, but it might be that for others.
Right.
Depends.
Okay.
Yeah.
Right.
Yeah.
Yeah, Nadisha, go on.
Yeah, no, just to highlight on the positive mental attitude. So something actually that helped me even before I went into IDH was, first of all, like, I mean, the idea of, an ambulance coming and just taking you away, to a place like without any choice is just crazy. That's just one thing to begin with. So to gather all the thoughts and to like kind of okay, you're going to do this, you're going to do this. But I won't lie, I was battling, back and forth, I can't do this, I can't do this. But then one thing is, I didn't fear the virus. My fear, this is the stigma that people have. The fear was, where are you going to end up in? That is what's stopping people from getting tested and from people, going forward and taking that sim, because they're afraid where they're going to end up. And maybe hearing stories like Kumo's and mine hopefully will help them realize that there are these places out there. And the thing is, I think we need to understand that this virus, it's inevitable right now. It's a global hit. So you have to be prepared to face it. So you need to be prepared to be infected. If you're going to live under a rock and be like, no, I'm never going to be infected by this, I don't think that mentality is going to work. It's important that okay, if you do get it, just be mentally prepared. If you're given 24 hours to decide where you need to go, you'll have to make up your mind at that time, because they're not going to send you off with your families. It's only going to be you and you alone. So it's very important to just make up your mind and just be like, what, I'm going to face this. But don't let it get to you in a negative way, where you have that bad fear going on, where you're just afraid that you're going to die. No, that's not going to help at this point. Do as the guidelines say, and just follow that.
Right. Anything else you'd like to add, Anthony?
The whole there was a voice clip that was going around, and I got it after. Thankfully, I got it after I came back from the quarantine center. About I think it was the lady who was saying that old people are taken away in a bus and gassed or something like that. I'm sorry. I know it honestly does feel like you're being taken away by the Gestapo. It does, right? When you're first carted off, these ambulance come, people in these alien looking kits come and they treat you like you're infectious and you are just taken away. It feels like you're being, it's scary, right? But The thing here is to not take it personally. It's happening to you, yes, right? But you have to think beyond myself. Now, I'm a teacher, and I got fever and my body aches and headaches and etc. That I decided to go and get myself tested. Now, I live alone with my dogs. And if I decided that I didn't want to get tested and I wanted to stay at home and rest, yes, I could have done that. But the propensity now, I, because I'm teaching, I might have gone out and do in-person classes, and I might have passed the virus on to other people, my students and their parents and everyone else who's around me at that time, right? So it's absolutely irresponsible of me. But if I get the virus, then that it needs to stop from me. That is how we need to think about it, that we it shouldn't go past me. And a lot of people out there, I know people who think, it's okay, I'll get the virus, I won't say anything, I'll just go around, everyone's going to get it anyway, so I might as well get it from me, is a mentality that a lot of people have because they are scared of what it might take. But guys, you might not die, I might not die, right? But I might have killed one of my students' mothers or grandmothers or grandfathers because I was too scared to go get tested and remove myself from society until I am not infectious again. And that weight I would have carried if someone died because of me. You have to think about it that way. Right? 'Cause I might not perish, but there are people out there who are vulnerable, children and old people. We have to not take this personally. You have to think bigger than yourself and realize that we have to be responsible enough to make sure that we don't carry the contagion past us. That is the message, the biggest message that I have.
Yeah, and that's also very important. Thank you for that, ladies. So before we do wrap up our panel discussion, Nadisha, you have actually been sharing your personal experiences when receiving treatment from the IDH as well. So as someone who went through this experience with your family as well, what message would you have to share with other people who have also been infected by this virus and who are afraid simply because of the stigma associated with it? What message do you have for them?
Yeah, first of all, I mean, just as Kumu said, don't be afraid to, if you have symptoms, you think it's flu, but then it's the usual symptoms of COVID, please go and first get tested, because like I said, I mean, it may not affect you, but somebody else, person B, can be the vulnerable person, and then that person can be affected in a detrimental way, and that is not fair to that person. So it's important to be selfless at this point. And again, that fear, don't have the bad fear, have the good fear. It's all, I think it's good to be afraid of the coronavirus, because that also is a good thing, but at the same time, again, don't take it personally as well, and don't go around blaming people, or because of so and so you got it, or so and so gave it to me. We are all connected. Finally, the whole global, all the countries are connected right now in this. So we can't play the blame game here as well. So I think it's important to be responsible and to follow the guidelines, the health guidelines. It's so important. I mean, if you're meant to stay at home to save another life, please do so. I mean, this is, I can't stress on it further than that. And I need to kindly mention Dr. Ananda Vijay Vikrama. He's the head of the doctor's unit at IDH. He is the person who actually attended on my father when he was having COVID pneumonia in the ICU. And he personally came in and he was, checking up on my dad and the team behind the glass doors. And I mean, I have seen several news articles that he has been pleading everyone to take the health guidelines seriously. So as a person who has survived COVID, I mean, it's just a small plea that I can, put out to the public to please take it seriously and to follow the health guidelines. Because if you don't, and if you take it lightly, you're going to endanger somebody else, even if it's not your own self.
I have one more thing to add, which is fairly important regarding this stigma, right? There are people, so a lot of the ladies that I was in the quarantine center with, there are quite a few who were asked to leave their homes, who were sacked from jobs because they contracted COVID, right? I mean, that also has is probably one of the reasons why people are running away without when the PSI guys come to collect them, because there for them it is catastrophic. It's a calamity, because I know ladies that I have had to help relocate to other houses and help them find jobs because they were told that not to come back. I mean, and those decisions are made by people of higher income brackets and should be better educated than the daily age earners. And you have to be fair, people. It is, you cannot keep putting more burden on these people. They are already very vulnerable, and making decisions like that is very, very unfair on them. Now, there are employers who insist that a PCR test is done before they are allowed back into the company. Some employers will pay for that PCR tests are expensive, right? But some insist that they do it on their own. How on earth is a daily wage earner going to collect even the 5,000 bucks from Jayawardhanapura? Is huge for them, right? It's extremely unfair. So we have to start thinking about a little bit more in terms of sustainability and helping these people out, because it's just crazy. And all of that is by fear. You can't, no one goes out and asks to get infected by this thing, right? I mean, it happens in some instances, but most people don't. So don't ostracize people because they got sick, probably because of an irresponsible action by someone else, right? So we have to keep that in mind.
Right. And Jude, do
That's
you
all I have.
have anything to say in terms of a message for people who are suffering with this virus right now?
Yeah, I think as I explained to you earlier, uh, it is the most vulnerable people who are suffering. So as leads, we are really focusing on the vulnerable segment of the society, particularly the children. So I extend this request to the general public, and if you all want to support this vulnerable segment of the society, then please do so and please join with us.
Thank you for that, everyone. And with that discussion, we'd like to end the panel discussion this evening. I'd like to thank all the panelists for being here with us and for taking time off their busy schedules to be a part of this insightful discussion. But before we do go, to all our viewers out there, we'd like to remind you to stay safe and to follow the health guidelines which have been put forward by the authorities for our own safety. And like Kumudini mentioned in the previous discussion as well, it's if you really think about it, it's not just us who we don't necessarily have to take all of these safety precautions only for ourselves, because when we take into consideration our personal medical conditions, even though we might not have any underlying health conditions, the people who we associate could potentially have some sort of underlying medical condition. And by associating with them, we put their health at risk as well. So it's really about being socially responsible in order to kind of fight this pandemic. So that being said, stay safe and stay home.